My name is Geta. I work for Academia 2063, and today we will be discussing about staple foods, systems dynamics, and COVID-19 crisis in East Africa. And it will be presented by Paul Gottinga, who is a senior policy analyst at ILRI and working for research projects. So he will be presenting his findings and also discuss some of the major issues that will be related to how these staple foods in Eastern Africa are being affected by the COVID-19 pandemics. And you'll have, Paul, you'll have 30 minutes to present, and then you'll have a question and answer sessions. So research methodologies and try to finish within the allotted time. And good luck, Paul. And thank you again for others too for attending this webinar.
Okay, thank you very much, Gitao. Good evening to participants joining from Eastern Africa. Good morning, good afternoon to others, wherever you may be joining from. I'm very pleased to be presenting to you this work. First, allow me to share my screen. I hope that you can see my screen. Yes.
Yes, we can see.
Very well. So thank you very much. I am presenting this work on behalf of two other colleagues, Joseph Karogia, who coordinates research in East and Central Africa, and Leonard Kirui, who is a research associate with us. So as introduced by Getao, my name is Paul Gottinga. I work at ILRI as a senior policy analyst in the research program. So we have been looking at the impact of the COVID-19 crisis and the measures that the governments have taken to control it on the prices of staples in our region. So far, we have done this in 3 countries. We have done this analysis for the cooking banana in Uganda, the matoke. We have done also for maize in Kenya and also maize in Rwanda. And this is what I'll be presenting on. So I'll start with an introduction. I will briefly talk about the methodology that we have applied, the sources of our data, and then I will go and delve into each of the commodities and the countries that I have mentioned, starting with cooking banana in Uganda, then maize in Kenya, and then maize in Rwanda, and then make some concluding remarks and recommendations based on what we have observed. The pandemic and the measures that were taken by government to control it have caused market disruptions and affected the prices of staples in this region. After the outbreak early in the year, in the month of March, governments in the region were quick to put in measures to control the spread and also contain the pandemic. The measures varied from restricting the movement of people and vehicles, banning of public gatherings, closure of schools, market bans, or very strict restrictions on market operation, closure of hotels and restaurants, even closure or restriction of even the border crossings, and also the night curfews. So during that period, especially for about 3-4 months when these measures were really in place, the market for staples were disrupted, both the supply and the demand side. And as I've said, we are focusing on 3 countries in our region and also 2 staples, 3 countries. So in brief, the methodology that we have applied is the SARIMA model, which is a common linear model for predicting future time series. Basically, we have looked at the historical prices, the monthly average prices of these commodities that have prevailed in the past for about 10 years for Kenya and Uganda, and for 7 years in Rwanda, and predicted, given the historical patterns, what would be expected to be the prices for the period beginning January 2020 to about July, and compared that with the prices, the actual prices that were prevailing then. In terms of the data sources, we sought and considered many sources as much as were available, and we made a decision to use these sources mainly because they were publicly available, they were complete, and they had a long-term series, or where there were gaps, it was easy to fill them because they were small, and we could use internal methods to fill those gaps. So what happened in Uganda? So we looked at the matoke, the cooking banana, which is a staple commodity there. It's consumed by about 13 million people. Production is concentrated in southwest and central region, and each year the country produces between 10 to 12 million metric tons. It is a rather perishable commodity, and therefore when you have market disruptions, it's likely to be affected. So we concentrated on 4 markets as written there: Owino in Kampala, Masaka in central, Lira in the northern part, and Barara in western Uganda. What did we find? In the January-February period, our analysis showed that about 25% of the markets were recording higher prices than they predicted. But from March going all the way to July, which is the last month that we considered, we noticed that all markets, 100% of them, the four markets I talked about, were recording prices that were lower than predicted. Okay, that is, the price of matoke was lower than actually would be expected given the long-term trend in the prices. And as you can see, looking at the period beginning January 2019 all the way to July 2020, you notice that indeed, when you look at particularly if you focus from the period beginning March 2020 all the way to July, the actual prices that were observed in this market were lower than predicted. The blue line are the actual prices. The red one is the predicted price. So what then could explain this? What happened? It is clear from this observation that the pandemic, together with the control measures that were taken, that I talked about earlier, seems to have clogged the supply chain of this commodity that is relatively perishable, so that there was a restriction in terms of supply from the production area to the consumer markets. And that had a significant, immediate, and uniform and negative impact on prices in all the local markets. This graph is showing the percentage difference between the actual and the predicted prices for all the markets that we considered. And as you can see, over the whole period, those prices were lower than what would be expected. And this is actually confirmed by even what the local media was reporting in Uganda. I have picked this photograph from online newspaper, The Observer, which was basically saying that matoke prices have dropped from 15,000 Uganda shillings to 1,000 in the Ankole region. So indeed, this is what was happening at that time. We will revisit back and maybe give a little bit more context in terms of what we think was really happening and why the prices dropped. But before we do that, let me also talk about what we observed with the maize price behavior in Kenya. We focused on 9 markets. Here we tried to do a little bit more in-depth comparative analysis within the country. We looked at markets that are located in maize surplus regions and also in deficit areas. So the surplus regions market is Eldoret and Nakuru. Then the deficit areas that are in major cities, we consider the 3 cities in Kenya, Nairobi, Kisumu, and Mombasa. And also other deficit areas that are relatively smaller towns, like Mandera in the north, Kitui in south, western area, Nanyuki in central, and Turkana or Lodwar up in the north. Now, the situation was not as clear-cut, but as you can see, in the retail markets, in the deficit areas, so in March, the prices in all the markets were lower than what would be predicted. We were coming from a period of really good rains and harvest last year and even early this year. But beginning April, because these measures in Kenya came into effect around mid to the 3rd week of March, we noticed that the number of markets that were experiencing higher than the predicted prices were rising all the way to July. For the production markets, we see that all of them had lower than predicted prices in March and April. Then in May, about 35% or so of them had higher than predicted prices, but majority were still having prices that were lower. Then there was an increase in June and then a drop in July. So in the maize deficit areas that are actually small towns, if you like, we noticed that during the month of March, the prices that were being recorded there were lower than what would be the long-term expected given the long-term trend. But from April to July, they were higher, except for April in Turkana. But the rest of the markets were actually experiencing higher prices than predicted. When we look at the major cities, the situation here is not as clear-cut, but of course we can notice that in the month of March, all the 3 markets had lower prices than what would be expected in the long term. But then in the month of March, 2 of the markets had higher prices. Then in May, Mombasa was experiencing almost 25% higher prices than would be expected. Then Nairobi had a higher price in June, but then in July it dropped, while for Mombasa and Kisumu, it was higher. And this is what we observe as the trend for one of the maize surplus area, that is Nakuru, we noticed that the actual prices from May all the way to July were lower than the predicted prices. Okay, let's shift gears a little bit and see what we observed in Rwanda. So here we focused on 5 markets: Kimironko in Kigali, Kibungo in Eastern Province, Byumba in the north, Gasarenda in the south, and Musanze also in the northern province. The story here seems to be that if you consider the month of January and February, about 40% of the markets were actually experiencing prices that were higher than they predicted. But then after that, all the way, in fact, we had data to September, we noticed that the prices were lower than what was expected. And again here, it is the same observation that we made in Uganda, that the pandemic and the control measures that were put in place disrupted the supply, of course, restricted demand because of the closure of institutions, of hotels and restaurants, and also because of the strict measures and the closure of the borders. The product couldn't really cross the borders. We know, for example, Rwanda trades a lot with the eastern part of DRC. But with this restriction, there was really inhibition of trade, and therefore there was actually a decline in prices in the local markets. And as you can see, it's very clear from what we can see in that graph that the prices were lower than would be expected. And I have also used this graph here to show the prices as they were behaving in one of the markets in Kigali, that indeed the actual prices were lower for, starting around February, they were lower than the predicted all the way. So in terms of the summary and our recommendation, so after the outbreak of the COVID-19 pandemic, the governments in this region, especially the countries that we have considered, put some strict measures to control and contain it. And some of these measures had unintended effects of disrupting supply and demand for agricultural staples. And in Uganda and in Rwanda, the reduced demand together with increase in supply from the harvest season, together with the trade restriction, led to fall in prices in local market relative to the long-term predicted prices. In Kenya, the pandemic was not uniform, as I showed, but in general, it led to an increase in maize deficit areas, especially those that are in small towns, further away from the main production areas. And of course, the restriction in the movement of people, vehicles, the closure of markets, the closure of hotels and restaurants disrupted those supply chains and affected the demand, leading to further decline in prices. And of course, as I mentioned earlier, the restriction in the cross-border trade had really major impacts in the price drops that we saw. All the governments in the region put place measures to cushion the affected section of the population. I think to the extent that it was maybe possible at the time. For example, in Kenya, they introduced the weekly stipend for poor households in urban areas. There was an expansion of social protection coverage in Rwanda in a project, I think, worth about 55 million euros jointly with EU. In Uganda, there was a food distribution program that targeted about 1.5 million persons in urban areas of Kampala and Wakiso districts, because the restriction meant that even those people who would go to do small businesses in the markets, in the hotels, didn't have a job at all, and therefore they didn't have even income to buy the food that they needed. So these are some of the measures that were being put by governments to cushion the people. So then maybe looking forward, given that this might be become a common occurrence, such pandemics, what kind of lessons can government learn and better plan into the future? One that we think is that to better manage future shocks, I think government will have to think to try and balance the containment and the restriction measures to ensure that there is minimal disruption in the flow of the staple commodities from farms to market areas, and also trade flows with neighboring countries, so that you know there's no to minimize the collapse of the prices and the markets within the countries, and also to ensure that neighboring countries that depend on those staples are able to continue receiving them. The other one we think is that there is need also to have better informed targeting of areas for which to impose restrictions that would help reduce large-scale disruptions. For example, we noticed in Kenya, after the initial very large-scale closures of major cities, etc., when the government began relaxing those measures, they would target the specific locations that had higher, cases of COVID. There's one area in eastern part of the city, Isili, that was put under restriction while free movement was allowed in other areas. This also happened in Mombasa, one of the major cities in the coast. When they relaxed the initial restrictions, they targeted an area, smaller area, the old town, that had the highest cases of COVID-19 for containment. So I think that such lessons have to be gleaned so that going into the future, should, for example, the second wave come, or should there be future shocks of this kind, then the restrictions are more targeted to avoid large-scale disruptions. So I think then that is where I will end. And I have displayed here the academia website, the research website, and also ILRI, where I work. And I thank you all for listening and look forward to fruitful deliberations. Thank you very much.
Okay, thank you, Paul, for your cross-country presentation. And I think I don't need to summarize, and mostly your data and your analysis are based on some price data to look at the market distortions, because that was one of the area where we expect a significant impact from the pandemics. So I think it's good to compare across countries also. And also I think one thing that's most important is the methodology that you use is comparing predicted and actual. And also they have different prices. So the overall results, I think, up to my understanding, that the pandemic has significant shock or disruption in Uganda and Rwanda, and maybe somehow reasonable in Kenya. That's what I can see from your data and your results. And but I think it's really good to look at these countries because of the common markets, because you are dealing with some specific commodities which have different specific demand in different countries. For example, if you take matoke might have a lot of demand in Uganda, may not be in Rwanda or in Kenya. So I think it's very informing observations and analysis on the markets. And probably one thing very significant across all the countries is the impact during March. March was the initial, the short-term impact, because at that time, the containment and everything was very significant. And then we have seen a lot of difference. That March was different from the rest of the years, the months, because after the containments are just becoming easing and all these things, then I think we saw significant changes. And thank you again, Paul, and you have also saved us some minutes. That will be for others, it will give a chance. But before opening for other discussions and for others to ask questions and all these things, and let me ask, I think, what are the prices, the type of prices you are taking? Because as you know, we have different prices. Retail price and the wholesale price, and also the producer price. When you are quoting or when you are getting those price data from different sources, what are the prices? Are they really the same? Because from the same market, you can get it a producer price where the producer can sell for the wholesalers, and you can get the wholesale price where the wholesalers sell for the another wholesalers, for retailers, sorry. And then you get another price, which is where the retailers sell for the consumers. So even from the same market, you might have these three different prices. So I think, which type of price you are getting from the different data? And then after this response, I'll continue for other questions. Yeah.
Okay, thank you very much, Nitao. We were focusing on retail prices for these 3 countries, 2 commodities. We are focusing on the retail prices. You are right in saying that there are different prices in the market, but we were focusing on the retail prices, and probably it might be important. Yeah, thank you.
Yeah, definitely. I was expecting the retail prices, but if you look at them from different markets, from deficit markets, and yeah, and then I think let me finish with this, the problem of data. How do you see the challenges of data? Because price data is one of, the easiest relative to the other productions and all other things. But still, for prices, we have a lot of problems, and because of timing, because for this type of analysis, we need very recent data and also up to the updated data sets. So how was it, for these products in what can be done, in terms of data collection?
Yeah, no, thanks, Nitao. I think that's an important question. First, notice that the methodology that we are using requires very long-term data series, all right? About 10 years or so. The kind of challenges we faced is what is common, I think, with the agricultural data in general. Number one is about availability, okay? Even where available, the completeness. There are instances, for example, as we were exploring, because we looked at different data sources. So, for example, in Kenya, we started looking at the data that is provided by government, the Kenya National Bureau of Statistics. They publish the monthly leading indicator publication. So we tried to go back all the way to 2010, but there were so many gaps in data that really that data could not be used for this analysis. So the challenge, even where the data is available, its completeness becomes a challenge. The other one is also the currency of the data. How updated is the data? Really, for you to do this analysis, as we are saying, you have to have the data March, April, May, June, up to July, for example, when they started easing those restrictions. Without that data, the updated data, it's very difficult to do the analysis. And also the choice of commodities is also affected by the availability of data. For example, I work at IRRI. I'll be very happy to pick one of the common livestock products, but the data is really a challenge. For example, I couldn't find a consistent source of data, say on milk, maybe for the past 10 years. So I think that is a challenge. And since we need data to make good decisions, I think then it speaks to the issue of investing in data in a consistent way, curating it, making it up to date, and making it easily available.
Okay, thank you. Yeah, I think that is a challenge. I mean, whenever we think of this type of analysis and all these things, those are the problems. But the other thing, maybe, I think you have mentioned about this, the food distribution, is because, I mean, most of your findings suggest that prices are declining than expected in many cases, not in all cases, but in many cases. That means that it's a disadvantage for the farmers. I mean, the farmers, the producers are the ones who are being affected mainly because of the price reduction. So I think this is very much unintended effect because of the pandemic and because of those lockdowns and all these things. So I think what the government can do that? I mean, how can we, in the long run, I mean, in the future, can minimize this type of things? I mean, the problem with farmers, and
yeah,
it may continue for sometimes, because as long as the pandemic is there, So what the government should learn from this?
Thank you very much, Getao. This is very important. Some of these commodities in our region, they are traded across the borders, both informally and formally. They flow from, for example, the surplus areas in Uganda into Kenya. They flow from surplus areas in Rwanda to Eastern DRC, etc. So I think one of the lessons is that there is need for countries to approach these pandemics and these measures from a regional perspective. I remember the initial stages of the pandemic. ESC was trying to come up with a harmonized approach. The concern then may not have been agricultural products, but they were saying we are so interconnected. Our people are flowing across these borders. How do we harmonize? How do we ensure that we have common and agreed ways of testing? How do we ensure that the trucks that are carrying goods across borders can cross with ease, etc. It didn't work very well at that point. I think countries were so concerned about domestic issues. But I think one thing going into the future, I think at the regional level, is to sort of have a harmonized way of dealing with these issues and ensure that there's minimum disruptions in the flow of these commodities so that the farmers are not affected. The other one is also, I think, what I mentioned. Within countries, rather than just blanket restrictions, it is very important to ensure that the corridors of flow of those commodities from surplus to deficit areas is the disruption is minimized so that the commodities continue to flow. Of course, the other one, which is a bit sensitive but also important, the demand centers, if you like. I mean, the closure of restaurants and hotels, the closure of schools and other institutions really affect demand. For example, I think I was learning in Uganda, a lot of matoke that comes into Kampala is consumed in hotels, in schools, in other institutions. So when they are completely shut down, then you disrupt the supply completely, the demand centers completely. So I think there will be need to have sort of measures in place. For example, when they were easing down, they would say, okay, hotels can operate, but then you have to maintain social distance. You have to test the workers so that you keep those centers open but still also win the twin goal of controlling the pandemic. So I think it's a bit more nuanced control measures that minimize the disruption, in my view.
Yeah, maybe one last one. I mean, before I open for the others, I think you mentioned some of the food distributions by the governments. I mean, for Kenya or others. What was the source of this food? Because it might have also implication on the prices and all these things. I mean, is it from the food reserve? Is it from, I mean, import from others? I mean, if you have any ideas about this, because this could be one of the explanation for the price reductions in all this.
Yeah. So for what I know for Kenya, the government used the stipend. They would send the poorest of the households in urban areas money to the phone, through the phone, to actually go and purchase themselves. But they also had a response committee that was receiving donations and doing purchases and distributing the food. But from what I observed, there was no major or significant buying of commodity from the grain reserve for distribution. But basically they were sending people money to buy from the market. And I think that's a bit more cost effective, so long as the targeting is done properly.
Yeah, that's good. Yeah, I think, thank you, Paul. I think many of you might have questions for Paul on different aspects and its implications, policies, and also even methodologies and all these things. So the floor is open for asking Paul questions and also comments and improvements and all these things, because we want to continue understanding the market, because the pandemic is not yet over, and we'll continue to look at some of the things that we observe from the markets, because the market, as you usually say, that it adjusts itself for shocks. So, I mean, we may see some different patterns and different trends in the future. So if you have any questions or suggestions, please.
We have actually 3 questions. The first one is from Martin Fowler. It is aligned with one of the questions you had, Peter Paul, and it reads like this: with this retail or wholesale prices dropped as production was high, as it was for the other starch staples, which form alternative staples at the same time. Disposable incomes fell, which also dampened demand. So this is from Martin Fowler. If Martin wants to take the floor and explain a little bit more, he's welcome to do so.
Yeah, thanks very much. Martin Fowler here. I work in Uganda. Very interesting presentation, very clear and excellent data. Yeah, we followed these prices very carefully from Farm Gain, which is an excellent source of information. We were doing this just to see what was happening to all of the commodities. And you're right, the prices did drop exactly as you showed. Using other sources as well, we were able to confirm that it wasn't only Farm Gain that was finding this. The prices dropped, but it did for all crops. And the reason was that we had an excellent harvest, the first harvest in the year. And also the disposable incomes fell dramatically as people started getting laid off for work. So it wasn't really any direct impact of government restrictions at all, or government support in any particular way. It was just that I think we feel it was just the market which responded to the normal signals of supply or the abnormal signals of supply, both supply and demand. More supply and less demand led to that tremendous fall that you indicated in all markets right across the country. But thanks very much indeed. It was a very interesting presentation. Over.
Okay, thank you very much, Martin. Maybe just a follow-up. The fall in the disposable income and the depressed demand, were those not related to the in a way to the measures, restriction measures by the government? What do you think? Why the fall in disposable income?
Well, because people got laid off from their normal jobs, and also the other important thing was that children were sent home, so they weren't in school, so the demand in the urban areas fell dramatically for food, staple food products, and people started to work on their farms at home. So I think we're already finding that production's up again for the second season. And we think that's probably because there were more hands, albeit child labor, but nevertheless very important. And that perhaps that's also a reason that explains our record coffee exports at the moment, because the kids are probably, you know, their parents say, well, rather than messing around at home, you can go out to pick some coffee from the coffee bushes. So although there are other reasons as well, but this is something I've heard recently being used as a reason why production overall has increased pretty dramatically in the country of all commodities.
Yeah. Thank you very much. Those are good insights. Yes.
Question is from John Msingwa, and it reads like this. Thanks, Paul. Kenya is a net importer based in East Africa. Did the study consider informal cross-border trade amid COVID-19 border closure in the south and west of Kenya?
Thanks, Joe. Yes, Joe is from Tanzania. No, we did not consider that because we were only looking at the domestic prices. Our reasoning or our understanding is that the flow could have been disrupted because of the restrictions in the border crossings. But I think that is something that probably when the data becomes available, one can look at it retrospectively to see how much maize was flowing into the country around that time. But it's also important to note that we were also coming from a season, the short rain season in Kenya last year was also very good. So there was quite a lot of maize in the country by that time.
We have a long comment from Mr. John Maynard, so I'll ask him to maybe unmute himself and start the conversation with you.
Sure.
Hello, Paul.
Hi, John. Good to see you.
Good to see you. Thank you for the presentation. And the results are a bit interesting because when we talk about the restriction, I'm looking at it that if we restrict them the cross-border market, and you know, Kenya is a consumer of maize from the region, we expected the prices to go up. If we are consuming what you have in the country, then I tell you that the COVID-19 Emergency Response Committee was able to facilitate the movement of the staples. So the restrictions were not quite the effect here. I would agree with the Mark that it's the depressed demand for the staples that is really affecting the country. Because even though you attribute the restriction to the depressed demand, the loss of income,
We've lost you, John.
Yeah, I think we lost him.
Yeah, he dropped out of the call.
But I can still see him online.
Yeah, but muted, right?
Actually, there are two John Maynard. One is unmuted. Let me try this one. John?
sorry for that.
Yeah.
So Paul, what I was saying,
Yeah, still.
We can hear you, but there is an echo.
I am also hearing the echo. I don't know where it's coming from.
We actually have two persons connected under your name. Are you using your phone and your computer maybe?
Paul,
Hello?
if you can hear me,
Yes.
maybe you read the chat. What I put in the chat, maybe because of these interruptions.
Okay.
Okay. Can I read it? I can read it if you want.
Yeah, please go. Mm-hmm.
Thank you for the presentation. I have listened to your explanation for lower price than expected and weighing heavily on restriction. In Kenya, I think we didn't have a strict restriction on movement of staples. In fact, movement of food was facilitated by the COVID-19 emergency committee. I think the explanation is the depressed demand of the staples. I think the same question as before. I mean, the explanation for the lower price is not mainly because of the restriction on the functioning of the market, rather on the fundamentals of the demand sides. So that could be the explanation for that. I mean, he wants to hear you on the explanation you gave for the lower prices than expected. Paul.
Yeah, thanks. Thanks, John. I think I understand what he's saying. It is true that even when there was cessation of movement in major cities, the government allowed some agricultural commodities and other important commodities to flow. The point here is that though that was the case, there were some certain restrictions in terms of the type of vehicles, the number of people who can come in, the requirements of the vehicles to be able to pass, which is sort of, it's not like there was unhindered flow of supply, but that may not be the big issue. But as he's saying, yes, the demand side of it, because of the closure of the demand hotspots, including the hotels and other eateries, may have a bigger impact. And also, as he says, the loss of income by people who lost jobs because of the impact of the COVID may have a bit more to explain. I agree, and I think it's the same thing that Martin was explaining in Uganda. But I think the important thing is to see this under the big umbrella of the pandemic itself, the restriction measures, and their unintended outcomes or the impacts. Because if everything was working as normal, probably would not be seeing what we are seeing. But I think I agree with him and his reasoning about.
Paul, but we shouldn't also forget self-restriction. Self-restriction. It's not the government, yes, because even the consumers can restrict themselves not to go to the markets and all these things. So the self-restriction could also have impact on the prices. So that could also be another explanation. Yeah.
Exactly, because I mean, even going to the markets to buy, the first about a month or so, there was really fear, if you like, of even going to the markets, so that people, volunteer not to go even if they need to, and that is part of actually the problem or the impact of the pandemic. It may not be direct, but actually it's part of it.
Yeah, another one. Nabu, are you going to read or?
Oh, it's up to you.
Okay, then I think I can read it from here. It's Antonio Salah question. I mean, it's very important. We have to define staple food. What's the staple food is the focus only on consumer food urban setting or rural setting? What is the staple food when we are referring to this type of foods? And this is one question. And second one, from his question, I understand that are you considering only the urban one, also all the rural ones, rural markets?
Okay, so thanks for that question. Yes, the functional definition that we used is commodities that are very widely consumed by a large section of the population. Probably we could do a better job of that subsequently, but we pick those commodities depending on the extent to which they are consumed by the large section of the population. And we try to spread our analysis in both in the major urban centers and also other centers that are outside the major towns. For example, we were looking at a market like, say, Mandera, Lodwar, etc. Those are not in major towns. The general setting of the area is rather rural area. But again, the issue there is the availability of data in those markets. But the desire, yes, was to consider both urban and rural settings. So,
Nabu, please.
Yes, we had a hand raised from Tom Kakuba, and his question was the maize in grain or flour form?
Yeah, thanks, Tom. Is the maize grain, and actually you are right about this issue of the form in which is consumed, but we were using the maize grain. We know that some household buy the maize grain itself, and then they have to take it for grinding in local grinders. A lot of people in urban areas buy the maize in processed flour form, but we were looking at the maize grain.
Next question is from Dr. Bayad. Did the three countries implement the same approach for assisting households with foodstuff? If not, was there a difference in impact on prices for different approaches? Example, food distribution, vouchers, sending money. Dr. Yad, if you want to elaborate, we can grant you. Well, please go ahead while we allow him to speak.
Yes, okay. That was my question, Paul, if you understand it.
Yeah, okay. Thanks, Mai. No, the measures were not exactly the same. But what we lack, I know for Kenya, what we lack is the details of information. For example, how that happened in Uganda and in Rwanda. In Kenya, they were sending mobile money to the poor households. That was one of the approaches. So the poor household in urban areas, they were receiving a weekly stipend of about 2,000 shillings. I think that's what it was. So it would be received on the phone, and then the household would use the money to go and buy. But at the same time, the emergency response team that John mentioned was doing something parallel. basically getting donations both in money form and also in kind, in terms of food, sanitizers, an array of products. And they were distributing them using their own system, which is not, we don't know, we don't have information exactly where this was, to whom it was distributed, but that was a parallel system where they were receiving collections from donors, from individuals, private sector, and they were not just limited to foodstuff. They would vary from sanitizers and other things, and then they would distribute them. So in Uganda, we know of that program that I mentioned that was targeting, I think, two areas. There were Kiso district, to help people who had lost jobs. But in terms of how that affected the prices, I think we need a bit more information. We only have the policy pronouncement, but we don't have the details of how that happened, but it's something worth following up.
Thank you. Next question is from Paddy Nusumbuga. He's from Uganda. He thanks you for your presentation, and he would like to know what is the future of e-commerce in agriculture and how it will influence agricultural product prices, since we see how the future of online delivery is coming to arise.
Okay, that's a good question, Paddy. I think it's a growing marketing approach. I don't know how widespread it is. It might be limited to a few buyers and sellers who have access to online platforms. But at the large scale level, I'm not sure how and to what extent that is likely to really take root, because I mean the traditional methods of buying and selling these agricultural commodities, we still see them. We still see bananas carried in lorries, in trucks, delivered to the markets. Wholesalers and retailers coming to buy from the main markets and then going to sell to smaller ones. That, I think, still remains the dominant marketing method. But yes, I think that with the spread of the technology, we may see more and more of the e-commerce taking place.
Maybe I can comment on that. I mean,
please go ahead.
Yeah, I think most of the researches, the findings that have been done, I mean, the research that have been done in Africa on the impact of these digital technologies and all these mobile phones and applications and all these things on prices, it is not, so far it wasn't that much significant. I mean, it has been done in different countries, in Uganda, in Kenya, in Niger, Ethiopia, everywhere. I mean, the effect of these digital technologies on prices, especially on producer prices, is not significant. Sometimes on the wholesale price, yes, there are some differences. But with the pandemic, it might be a little bit different. I mean, because they might be forced to use their digital technologies, even to ask for prices and to communicate, to search prices and all this, let alone the deliveries, because the deliveries might be a little bit, they may require some sort of institutional arrangements. It's because even from farmers to consumers, there are a lot of people involved in those processes. So I think that we need a lot of arrangements to really get the benefits of these e-commerces and all these things. So I think these are the findings that we have so far, but we may get something different after the pandemic, because there is something external, because that will force everybody from the marketing system to use available digital technologies rather than going for face-to-face transactions and all these things. So I think we expect a lot of changes on those areas, but it has to be seen in the future. And these are just comments here. Thank you. Back to you, Nabu.
Yeah, thanks.
Thank you, Gitao. We still have Dr. Riyad's hands up, so he may want to comment, but we also have questions from Oliver Girui, who is a co-author with you, Paul. So, Oliver, please.
Oh, it's a different
Thank you, Paul, for that very good presentation. I followed it and I really enjoyed it. I just wanted to ask about the role of the producer organizations or farmers organizations in this sense. Do you see any potential for them helping the farmer, the different collection of farmers to negotiate better prices than what we've seen?
Thanks, Oliver. Good to have you. I think that there can be and there is a role for farmer organization. Now, I think you and I know that some challenges that farmers face, and especially for staple products like maize, where individual farmers are only producing small quantities, and they're only selling the surplus, and therefore there's a challenge of actually bulking the product in farmer groups and being able, to negotiate in the market. The potential is there, but I think the underlying issue is how do you bring together small producers who barely have surplus to sell, or who only sell when they have surplus, to actually come together and bulk their product and be able to now go together in the market as an organization and negotiate for better prices and have the patience to wait. You know that farmers sometimes basically want to sell their maize quickly. They take maybe a bag of maize to the market to sell, so that they buy food, or maybe they pay school fees for their children. So they have very immediate need, and sometimes the patience of joining others in bulking and really selling is a challenge for these staples. This, of course, works for the cash crops. Of course, the coffee and tea and other products. And also, I think it works better in milk, but in staple commodities like maize, I think there's many issues that would have to be addressed first before they're able to do that.
Apologies for assuming that it was you, the co-author. So we have another question from John. John Mayna, how are the volumes transacted against the reported monthly prices?
So I think that's a very good question, John, and it's part of the challenge we have with the way the data is recorded. So that even within the Kenya National Bureau of Statistics data set, it's only the price, but there's no really volume transacted. So that even being able to, for example, come up with a nice, maybe weighted average of the price is very difficult. It could be that 1 month in a year, maybe after the harvest, they transact maybe 40% of the volume, but in subsequent months, only trickles come in, for example. But we don't have that data, at least not from the sources that we were looking at. But that would be, I think, one of the recommendations of the improvement of the data capture that is required for better analysis and policy response into the future.
Tom Kakuba would probably like to comment. He shared comments that starts by Getao asked the source of food distributed in Uganda. First, what was the distributed was not matoke, but main flour, beans, etc. Secondly, the source of food for the target's 1.5 million poor people was government funds. Individuals and companies donated to government, but also directly to the beneficiaries. So, Tom, if you'd like to come and maybe explain better what you mean, it would be appreciated.
Yeah, one more question for Tom. Tom.
Yes.
Where did the government got those food? Where, from reserve? From what was the source for the government? I mean, where did they get it?
Okay, I'm going to comment on that one too.
Okay, good.
Yes, you can see the analysis. Uganda's analysis was about matoke, but that was not one of the commodities that was widely distributed, either by individuals or by government to the vulnerable. Secondly, government doesn't have, or Uganda doesn't have, what we would call a grain reserve, like in countries like Kenya. So the government was buying from the private sector. There are those grain stockists, and it was buying from them and distributing to the 1.5 million people. But it also got donations from companies, from individuals. Other people, even beyond the 1.5 million, were getting donations of food from the individuals, but also companies as well, directly or through the local governments. They would give the food to the local governments through the COVID task force, which would distribute the food to the vulnerable in those areas. So that's how, in brief, the distribution was done in Uganda by government and also by individuals. I wish to thank Paul that you prepared this presentation, and I'm impressed by the results, except I think we still need, not Paul alone, we still need to make use of these results for recommendations, because I think there is a need to refine the recommendations that can feed into policy. Thank you very much. Over to you.
Thank you, Tom. Paul.
Thanks much, Tom. And maybe, do we have, if I may follow up on that, because that is the information we are missing, do we have information on the quantities and the products that the COVID task force received? Can we have, is it possible to know how much they procured from the local market, how much they received as donation? Is that data available anywhere, Tom?
Well, I don't know, but my colleagues from Uganda who are listening in could chip in if such data is available. But I know FarmGain Africa does not collect data on the quantities transacted through the markets on various commodities. Thank you.
Yeah, I think, Tom, maybe one small comment on this. Even if the government didn't distribute matoke, and there could be some sort of substitution effect because of the substitution effects, and then it could have impact on the prices, because I mean, if you distribute maize or beans or something, and then it might have effect on the matoke prices. So that could be also another possibilities. Just, yeah. Back to,
yeah, it is.
to
Oh,
Nabu.
sorry.
Okay, so.
Yes, we have another question from Antoinette. She'd like to know in financial terms, what has been the contribution to the public purse?
The contribution from who?
No, I think he is asking about the financial cost for the government. It's because if the government is distributing food for the poor and all these things because of the social protections, and they have to pay something. I mean, do you have all those informations, how that affects the financial force of the government there?
The mic has been allowed for Antoinette.
Oh, is he around? Okay.
Can you hear me?
She's muted.
No. Can you hear me?
Yes, we can. Please go ahead, ma'am.
Yes, I just wanted, thank you very much for the presentation. Just to find out how the governments of Kenya, Uganda, and the other country, Rwanda, managed to fund, all this distribution. Hello?
Yes. Oh, thanks, Antoinette. Yeah, that's a good question. I think we do have estimates of the cost of those programs. Some of them we have put in the brief, because they would put some estimated cost of those programs. And some were monies that were coming from the government themselves, from the public coffers. Some were donations or funding from donors. And of course, they were also receiving donations from private sector and others. But yes, for the government-funded programs, the cost estimates are available, and we can include that information.
I think these are the questions, yeah? Do you have any more? No.
May I? Do we have a minute? Nabu, if you would allow my colleague.
From
Please.
I'll give you the chance, but let us first receive from Greenwell. Greenwell has raised his hand.
Oh, okay. So, Paul, very nice presentation, and great for that. You should keep it up. This work is very interesting. So I was just thinking, given your understanding, I mean, especially because I know also that you are involved in the JSRs and biennial reviews on the continent, or in East Africa in particular also. Do you think, I mean, just your own thinking, I mean, I don't have an answer for that, but do you think that the data issues that you're talking about here, could be related to the JSRs? Is there a role for joint sector reviews and biennial reviews in sorting those things maybe going forward? Thank you. That's the only question.
Yeah, thanks, Greenwell. Yes, they are linked. For example, you and I are in the PR task force, and we have been trying to follow this. If you recall, this indicator on the farm gate price, the wholesale price, and looking at those prices and how they are changing over time. I mean, these are the data we are talking about. And as you know, of course, a lot of them are not available. A lot of countries, and there are a lot of gaps. A lot of countries don't have them, and where they are, there are a lot of gaps. And I think a situation like this, a shock like this, just brings again to the fore the need for data collection in a consistent, coherent, and in a continuous manner, if you like. Because when a situation like this comes, you really need good data to be able to do a good analysis and to inform your policy decision. You also need the same data to inform the effectiveness of the programs that you are implementing. That is, when you are doing the joint sector review, the agriculture joint sector review, you need the same data to see whether what you are doing is effective. And of course, for the biennial review, for reporting and for assessing progress, you need the same data. So I think it's a good reminder of the need for good data coming from another fora that we don't normally have, like there is a shock, we need data to analyze, and somehow the data is not readily available. It speaks to the same point. So, but maybe before then, I was asking Nabu, I have my colleagues, Joseph and Leonard Kirui, who have been listening. They may have a point or two to respond to some of these issues. Would you allow them, please?
Yes, we will do that. Cher, could you please allow Joseph and Leonard?
Yes, they have the floor now.
Hello, can you hear me?
Yes,
thank you very much, moderator Nabu and Paul, and thank you, Paul, for a good presentation on what's happening to food prices in this region as a result of the COVID pandemic. I think the main issues are very well covered. The one of the things that I noted from the comments is that the depressed demand is a big issue in the region, and perhaps it's something that we need to look at maybe in future work. People who mostly work in the informal sector were immediately affected by the pandemic, the restrictions in movement, the closure of markets and restaurants and so on. And they lost their jobs overnight. And that could be a big contributor to the depressed prices. There are also the low-income consumers that probably buy these products. If we talk about maize and matoke and so on, directly for consumption, the purchase behavior of the relatively well-off and who didn't lose their incomes immediately could also have shifted to buying processed products, buying in supermarkets, buying flour, maize flour rather than maize itself. And we can also not probably dismiss completely some sort of panic buying, but not of the if you like the unprocessed products, but probably more processed products that could better be stored and so on. So very interesting issues have been raised, and with the important policy implications, and we should pay attention to this as we continue with this work. Thank you very much.
Okay, Leonard, is it up?
Okay, thank you very much. Yes. Yeah, thank you very much, Paul, for representing us here and making the presentation. Something I would just like to add, I think Paul has mentioned quite a number of things, but something I would like to add is that we would have loved so much to have a wider scope of the analysis. Like I'm looking at the case, like for example, Rwanda, we had initially selected up to almost 60 markets to look at, but because of the inconsistent and completeness of data, we were only able to manage like 9 markets. the same case applies to Kenya. So we were able to do an analysis of very few markets due to lack of enough or complete data. So I think that is still a big challenge, as mentioned by Greenwell. We still have a lot to do in this area. So like we have a lot of markets across the country, but the data is not complete. So the scope sometimes is limited because of lack of enough data. So that is only something that I wanted to ask. Otherwise, we thank everyone for having found time to attend this presentation. Thank you.
Yeah, I think that's all. Thank you, Paul and Leonard and Joseph, for your research and presenting on this. And then I think if I don't see any hand up except Greenwell, I think Greenwell is that from previous. Is that? Yeah.
Oh, sorry, it was from previous time, sorry.
So I think it's almost time. So back to Nabu, if you have anything to say.
Thank you, moderator. Thank you, Paul, for the great presentation and for all participants. On our side, we would like to just remind our participants that the RESAX conference will start next week from November 3rd to 5th. Sorry for the assistant talking in the background. We will kindly ask you to join us to this conference. The link has been shared with you in the chat box. We welcome you at the conference and we would be pleased to have you. We will also like you to know that all of the elements are available. The elements discussed today are available on our COVID-19 portal. The link has been shared with you as well in the chat box. I think we've missed one comment, moderator, but yes, I'm leaving it to you to decide what to do with it.
Which comment?
Oh, actually, it's an appreciation. Josephine Love saying this was great.
Thank you. Okay, I think now we are done.
Yeah. Indeed. Thank you, everyone, for attending and for listening. We appreciate it.
Thank you.
Thank you.
Thank you.
Thank
I
you.
think we are done.
Asante. Asante.
Thank you.
Sana.
Asante
you.
Greatwell.
Asante, Asante Greatwell.
Bye, brother.
Okay.